Hi, everyone. I'm Katie Couric. As many of you might know, I've been through my own breast cancer journey. And the one thing I've learned is that the story doesn't necessarily stop when treatment ends. In fact, for so many women, that's when a whole new chapter begins. Today, I'm talking with Dr. Lillian Smyth, Senior Vice President and Global Development Head for Breast Cancer at Eli Lilly and Company, as well as breast cancer patient advocate and Lilly partner, LaShae Rolle. We're talking about life after diagnosis and treatment, why knowing your body's normal is so critical, how to understand your risk of recurrence, especially when diagnosed with early breast cancer that does have a high risk of coming back, and what it means to be your own advocate in follow up care. Dr. Smyth and LaShae, welcome to both of you. I'm so excited to be with you and have this important conversation about breast cancer and really life after breast cancer treatment. And Dr. Smyth, may I call you
You
Lillian?
may, of course.
Let me start with you. I know you went into oncology and then you decided to really focus on breast cancer.
Mhm.
What led you down this path? What was it about breast cancer in particular that interested you?
Honestly, it was the patients that drew me in. I mean, obviously, breast cancer predominantly affects women. And I got the sense really early on in my training that these were the women and the patients that I wanted to look after. It just always felt like critically important work. And then I would say, added to that, the science pulled me in. Breast cancer is one of the fastest moving fields in oncology. And the more I treated patients, the more motivated I became to really try and find new and improved ways to care for those patients. Ultimately, I just wanted to be part of driving improved outcomes for patients with this disease.
LaShae, I know that you share a lot of interests with Lillian and that you were studying breast cancer prevention and you were getting a PhD and or still are in public health when ironically you were diagnosed yourself with breast cancer. Tell me about that. And that was, I know, in 2024. You were just 26 years old, LaShae.
Yeah, I was young. So for me, basically, I was in the middle of my PhD, second year of my PhD, and I thought I'm doing cancer research, cancer prevention in particular. And I felt a lump. I was like, that's one of those things that I tell people might be a risk factor. And I felt a little pain in my breast. And I was like, that's another red flag. And so I did what I hope many people do when they find that something is wrong, they go and they get it checked out. So I went to do a woman's health exam at the Student Health Center, and they let me know that, you have a lump there. Maybe it could be something, could not be. Most likely due to your age, it's fibrous tissue. But they went and sent me off to do a mammogram and an ultrasound anyway. And we all know how that story ended. They found that I did indeed have cancer. And I credit me doing my PhD in this field to finding that, because I think had I been in a different place in my life or not in this field, I would not have been alarmed by those things. And I maybe would not have known that that was something that could be related to cancer. And so my biggest thing that I tell people all the time is get to know your body and what is your normal so that if something is wrong, you'll know to get checked.
Well, thank goodness, Lillian, that LaShae was studying this, knew that this needed a medical attention, did not blow it off, went and got
Absolutely.
it taken care of. But goodness, she's 28 now,
Mhm.
just 26 years old.
Mhm.
We're seeing many more people,
Mhm.
many more women getting diagnosed with breast cancer at an earlier and earlier age,
Mhm.
aren't we?
We are. I mean, in fact, it has resulted in us sort of adjusting the screening guidelines within the US to lower that age to 40, where the recommendation is to have yearly mammograms from that age. So there is no doubt that younger age at diagnosis breast cancer is rising in incidence, both globally and specifically within the US. So it's really important that folks remain aware of that. And I think telling stories like LaShae is describing today is just hugely important for everyone to understand the changes that are happening out there.
Because at her age, she was well below the
Mhm.
guidelines
Right.
for getting screened, and yet you were aware enough to notice a change in your body. And LaShae, I really admired the fact that you have shared your experience very publicly. You've created a platform, you talk about what happened to you. Why has that been so important to you?
It's been extremely important for me because at the time when I was diagnosed, I went to Instagram. I went all over the internet and I tried to find somebody who was like me, that was sharing maybe some aspect, not even the full story like I am. And I couldn't find anyone. I couldn't find anyone my age. I couldn't find anyone that looked like me. I couldn't find anyone who was powerlifting. And
Oh,
I
by the
said,
way, yes, bury the lead. You're a power lifter, and we'll get to that in a moment.
yes, and so what I wanted to do was I wanted to create that person for other women who are going to be diagnosed young or who want to engage in those activities or who have similarities to me. And so that's why I wanted to share that, to spread awareness and to have somebody who was out there to be that person that I needed at the time.
What kind of feedback have you gotten, LaShae? Has it been gratifying to see that you're striking a chord and educating so many women who not only look like you, but who don't look like you
Oh
and
yeah.
need to be aware of the symptoms of breast cancer, especially at an early age?
Yes, so it's been monumental. It's taken off much more than I even thought. So initially I just posted that and I did want to share it with some people and I did want to make an impact, but it's made much more of an impact than I could have ever thought of. Reaching people in different countries, like you said, not just who look like me, everybody, and getting people moving and people tagging me and saying, "I'm working out today because I'm channeling my inner strong after cancer." And I'm like, wow, this is incredible. And I'm people are messaging me saying they got their first mammogram because they realized that I was diagnosed so young and it actually runs in their family and they weren't just getting screened, even though it runs in your family. And I'm sure that many people can get screened because when you have a genetic history, they do allow you to get it covered and screened. And, you know, I'm very proud of what has happened. And I think that I have no regrets.
Well, I'm so proud of you that you have shared your story. And I want to mention something because I think sometimes family history is used as an excuse, or no family history, I
Mhm.
should say, for not really paying attention to many cancers, including breast cancer. And the fact of the matter is, Lillian, that most women who are diagnosed with breast cancer have no family history, right?
Correct, entirely true. Exactly. So, I mean, I think that that's to your point, it's about understanding that you need to know what normal is for your body and to report any symptoms or red flags, as you term them, like new lumps, pains, issues. You really have to talk to your doctor about them and don't dismiss them and think, oh, well, this would never happen to
Or
me.
it doesn't
Because,
run in my family
correct, because
Mhm.
the,
because it didn't run in Lachey's
mhm,
family.
Mhm.
absolutely.
Let's talk about the steps you need to take after you're diagnosed. And just having experienced it myself
Mhm.
a few years ago, the staging is critically important. So, can you help people understand who haven't gone through what Lachey and I have or don't have your background, Lillian, what the difference is between early stage breast cancer and metastatic breast cancer?
Yeah, absolutely. So it's a critical distinction, and it's the distinction that we make right at the time of diagnosis. So early stage breast cancer is by far the most common presentation. And that's basically consists of breast cancer that is confined to the breast or the local lymph nodes. And the treatment intent for early breast cancer is cure. Typically, it consists of surgery first, so either a partial removal of breast tissue or full removal of breast
So, you're
tissue,
talking a
a
lumpectomy
lumpectomy
versus a
or a mastectomy,
mastectomy.
exactly. And then often that's followed by radiation therapy. And then in some cases, chemotherapy or targeted therapy like hormone therapies are offered. So that's early stage breast cancer. Metastatic or advanced breast cancer is breast cancer that has spread beyond the breast and local lymph node area to a distant organ like lung, liver, or bone. And the treatment intent in that scenario is different. It is long term treatment that is focusing on disease control and maintaining quality of life for as long as we can. And
That's why early detection is so critically
absolutely.
important because it is much easier to eradicate the disease when it's caught early instead of just managing the disease.
Correct entirely. Absolutely.
Let's talk, LaShae, about life after treatment. Your breast cancer was stage 2B. So that meant lymph node involvement, correct?
Yes, so I had lymph node involvement.
So that meant you needed chemotherapy and you got a mastectomy.
Yes.
So, first of all, how was that treatment for you?
So for me, it honestly it was a lot. So being so young and having to have my breast removed, it was just something I was not thinking about at all. And it's something it feels so feminine. Like it feels like something that all women have. You have your breasts. That's one of the things that really sets us apart. And so I had that removed and that was a big thing. But then when I found out later that it had spread to some of my lymph nodes because we were still waiting for how many positive lymph nodes I had after surgery, found out I had to do chemo. And, when you hear the word chemo, it's very
Mhm.
intimidating. And so I had to do Taxotere and cyclophosphamide, that's TC, for 4 cycles. And I lost all of my hair. And it was very, very emotional for me. But, after I lost my hair, I was like, well, that's it. Smooth sailing from here. I was trying to avoid losing my hair. That was the biggest thing. And I just powered through it. And with the help of my family and my dog, he was a big part. He was a big part of my journey. I was able to get through those 2 parts, and then I had radiation afterward, and
Which can be make you very tired, right?
Mhm.
oh, yes, I had a lot of fatigue, and there was some marks, so it had some burning and discoloration in that area, but just like chemotherapy, I got through it, and I didn't stop doing anything throughout it. Throughout all my treatment, I was still doing my PhD. I was still working out. I was still living my life, and I didn't let it stop me. So it might have been hard, but you know what? I'm tougher than cancer.
Mhm.
I think a lot of people focus on the treatment, LaShae, but there's also life after treatment. Something that I think patients aren't necessarily prepared for. Lillian, what do you tell patients who are saying, okay, I'm done,
Mhm.
about the things they might experience once the treatment is, you know, actually over?
Yeah, it's such an important question. So I would say once the upfront treatment of surgery, radiation, and chemotherapy is completed, patients move into this active follow-up schedule of follow-up visits. So typically what that looks like is they will be seeing their clinician every 3 to 4 months for the first 2 years. Then it sort of moves out to every 6 to 12 months up until year 5. And then after that 5th year, they're really just coming in every year. And the purpose of those visits is really a check-in to see, how are you doing? Do you have any worries or concerns? Do you have any symptoms that are new? Have you any side effects from treatment? Or are you experiencing new side effects from ongoing treatment? It's really an opportunity to support those patients who are still on ongoing treatment, because as you may know, many breast cancers are hormone receptor positive, and for those patients, they're recommended hormone therapy for at least 5 years and sometimes up to 10 years. So it's actually really important to check in with those patients and see how they're doing. Are you actually taking your medication? How does that feel? Do you have side effects? And the typical issues that we would be discussing in clinic are things like sexual health, hot flashes, bone health. And it's just really important that patients feel comfortable to bring up these topics in the clinic. I would say from an imaging perspective, their follow-up usually looks like a mammogram every year. We follow bone health with a DEXA scan every other year, and that's really important for postmenopausal patients and patients who are on hormone therapy. And then, as you mentioned, family history and genetics, if we identify that a patient has a family history or an increased risk, a genetic risk, then we have to tailor their treatment plan and their follow-up appropriately. So I guess I would say high level, life sort of after the upfront treatment really looks like staying very connected with your care team, being proactive. And, for us as providers, it's just about giving patients the tools to live well so that all issues can be flagged early.
LaShae, you have been a very vocal advocate for your own follow-up care. Tell us about that and examples of how you have spoken up and made your needs known to your healthcare providers.
Yeah, so one of the biggest things I do is I share with people on Instagram that if there's anything wrong or you have any issues, make sure that you tell your care team that because it's very important. Like doctor said, you must, you know, keep your team informed. And so for me, like doctor touched on, a lot of those things like hot flashes, etc., because I'm also hormone positive. There are a lot of things after cancer treatment, and so for me, I just would share those things with my doctor, and I would let her know, and she would basically tailor a lot of those hormone therapies and just help me have a overall much better experience. And I've been able to maintain and stay on all of the drugs, and I'm in a good place. All of my scans are clear, and everything's going well. So I would just say having that open line of communication and just being aware that your body is still going through a lot and trying to recover after treatment. I would say that cancer patients, no matter what the type of cancer, just know that your body went through a lot and just be gentle with yourself and try to build back.
But I think you're so right. I mean, I think it's so important for patients to talk to their physicians about, say, the side effects of
Mhm.
follow-up care. For
Mhm.
example, aromatase inhibitors, right?
Mhm.
If you have breast hormone receptor positive breast cancer, you have to take these inhibitors that basically suppress estrogen
Mhm.
because the cancer feeds on estrogen. Am I getting that right,
You are
doctor?
entirely, yes.
And there are ways to mitigate some of the
Mhm.
side effects from taking those drugs. And a lot of women do not take the drugs because of the side effects. And it's
Exactly.
really important to talk to your healthcare provider about that so they can help you manage the side effects and you still take the drugs.
Mhm.
Absolutely. That's the message.
How do you get women to feel comfortable and feel like they're not bothering you by saying, "Hey, Lillian
Mhm.
or Dr. Smith, I feel like hell because
Mhm.
of this, follow-up medication and, you know, I sex is painful or my
Mhm.
bones really hurt." I mean, there are all kinds of things that sometimes come with that. And how would you encourage women to be open and
Mhm.
honest and assertive about that, without worrying that they're whining.
Oh my God,
Mm.
yes. I mean, I think it starts with just giving yourself permission to ask questions, right? And lots of them. And start broad. If you don't understand what follow up looks like, ask the question: what does my follow up look like? What should I
Mhm.
expect from these clinic visits? I mean, I always say to patients before a clinic visit, just take a few minutes to sit with yourself and think about, how am I feeling? Do I have any new symptoms?
And write it down,
Write it
right?
down. That's
Mhm.
exactly what I was going to say, right? Like, make a note of your symptoms, your side effects, your questions, your worries, your concerns, and just bring that in with you into the clinic visit. Because, often patients are like a deer in a headlight, right? When they arrive at the clinic visit. And I think it's important for you as a patient to feel like you've used your time well and that
Mhm.
you leave that clinic visit satisfied that you've gotten that opportunity to ask all of those questions. And I will say, I do think that clinicians are genuinely of the mind that they want patients to feel empowered to talk to them openly. And, open and honest communication is a good thing. This can improve outcomes because it will keep patients on therapies longer.
Mhm.
Let's talk about recurrence because obviously that's what you really are trying to avoid for
Hmm.
breast cancer patients. And how do you determine the likelihood of recurrence? Today, breast cancer doctors, oncologists have all kinds of tools at their
Right?
disposal that they didn't have even
Hmm.
like 10 years ago that
Absolutely.
can help really determine the kind of care a breast cancer patient gets.
Mhm.
So let's talk about recurrence.
Yeah. So recurrence is a term, or risk of recurrence is a term that we use a lot. And really, what that means is the chance of the breast cancer coming back after you've completed treatment. So, we think about risk of recurrence when we're trying to estimate that risk. We look at patient factors and we look at tumor factors. So, the things we consider in patient factors are, age at diagnosis, that's critically important. Is there a family history? And then the tumor factors that we're especially interested in are how big is that tumor? Has the tumor spread to the local lymph nodes? What is the grade of that tumor, which is really just a pathologist's way of describing how different that cancer cell looks to normal cells.
Mm-hmm.
And then we look at the tumor biology. So you mentioned the estrogen receptor. So we stain the breast tumor tissue for the estrogen receptor and for the HER2 receptor. And if a patient is found to be positive for those receptors, that information tells us that we should consider a specific type of targeted therapy for those patients. I would say that we also, as you mentioned, have lots of new tools. So we sometimes use validated risk scores, which basically pool all of that information together. We use genomic tests, and all of these information factors essentially give us a more precise estimate of risk. Once we understand what that risk of recurrence is, then we can tailor the treatment plan. We can decide with the patient whether chemotherapy or targeted therapy like hormone therapy is needed. I would say it's important to recognize that talking about risk of recurrence is not about creating fear. It is about ensuring that patients are getting the right treatment plan that is individualized to their situation. So, information is power. That's the reality.
Amen to that,
Yes.
sister. And
Yes.
I am so thrilled that doctors like yourself have this whole panoply of tools
Mhm.
now
Mhm.
that can be really evaluated in concert and help a patient navigate and determine the course of treatment. And LaShae, Miss PhD in public health, somebody who really understands and whose specialty is cancer prevention. How did these tools help you navigate your own treatment and sort of life after treatment?
Oh, it helped me a lot. It helped me understand more about what was going on because a lot of the things that, from the patient perspective, you're just confused and you don't know what's going on.
Right, that's a lot to kind of
It
digest, all
is.
that stuff that Lillian was talking about,
Yes.
right?
You're like, "What?" Like, imagine if you know just nothing, nada.
Right.
What is ER positive? What is
Mhm.
PR positive?
What are
What
the
is
genomics
HER2?
and
Mhm.
What
what's
is a
this?
mama print and an oncotype? What is
Mhm.
Right.
that? And so for me, being able to break those things down, read studies, it helped me a lot with my treatment. For example, with my surgery, I had a unilateral mastectomy. So only one side, the breast that was affected, was removed because studies have found that there was no benefit to doing a bilateral mastectomy. And so, together with me and my surgeon, we decided on just removing the diseased tissue. And so, me being able to break that down and read things as an epidemiologist and understand statistics, it helped me a lot. And so, then also being able to look at the oncotype and mammoprint results that I got, I was able to look at my risk of recurrence. And so, I saw, okay, if I take an aromatase inhibitor or something similar to that, my risk goes down by this much. If I have chemo, my risk goes down by this much. If I have radiation, and so because of that, I think that's one of the reasons I ended up opting for everything. Give me everything to make sure this does not come back, particularly because of my age, because
Mhm.
just because I'm younger, I'm going to be around longer. So inherently, I'm going to have an increased risk because of the mere fact that I'm younger. So I wanted to have my best bet of never seeing this disease again. And so it helped me a lot with that. And then also doing a lot of the complementary treatment. So being able to lessen my stress, eat more fruits and vegetables, and following some of those guidelines, working out, and just working together with some of my mentors. It was just great.
We talked about treatment and follow-up after your initial treatment, but one of the things I didn't ask you about, LaShae, was some of the sort of psychological
Mhm.
and physical, challenges that one faces after breast cancer treatment as they continue on this path. And as somebody who is a power lifter, what does that mean exactly? You just lift super heavy weights? Is that the deal?
Yeah, so with powerlifting, it's 3 lifts. So it's squat, bench press, and deadlift. And so it's the cumulative total of those 3 lifts. And so
Wow.
you try to lift as much as you can for one lift, and you have 3 attempts in a competition. So, yes.
How did you get into that, by the way?
So I played college basketball, and during the training, we would do a lot of lifting in the gym to strengthen up.
Uh-huh.
And I noticed, wow, I'm pretty strong. I'm stronger than a lot of the people around me. And so once I completed playing college basketball, I said, "Oh, I'm not going to just sit around and do nothing. I need to work out and do something." And I wanted to compete as well because I'm a competitor. I've been competing my whole life. And so I said, "Okay, this is the best of both worlds. I can work out and not do too much running and stuff because all that running was it was a lot with powerlifting, and I can compete." And so then that's what I did.
So I'm thinking about you as a power lifter and somebody who is a competitor and loves doing that, and you get a mastectomy,
Mhm.
right? Which often affects your mobility, um, and also your energy level.
Mhm.
So that was something that you had to overcome
Mhm.
following your treatment. What was that like?
It was very difficult, mainly because it's like a block. It was a mental block. It was like, that area is removed. How am I gonna
And
lift?
I'm
Will I
sure
hurt
it
myself?
affected, right? Your
Mhm.
just physically how much you could move your arm, right? For a
Yeah,
while.
in the beginning, yes. So about a month after my mastectomy, I had full range of motion only because I did a lot of prehab. I met with a physical therapist, and due to my background working in lifestyle medicine with oncology, I just knew the blueprint and what to do, and I prepared for it. So I think a month turnaround is just insane when I look back at it. But for me, yeah, it was a period of time where I did not have that mobility or the strength. But by the time I reached chemotherapy, I was bench pressing 250 something pounds.
Good lord.
Wow.
So,
Mm.
That's amazing. I mean, you look at LaShae Lillian, and she's sort of an ideal patient
Mhm.
because she had such a deep understanding
Mhm.
of cancer prevention because she was studying it. And she did, I think, everything right. I mean,
Mhm.
she did the what do you call that?
prehab,
Prehab.
rehabilitation.
Yeah, and then rehab, so she gets, like, a gold star in every
Mhm.
category, but a lot of people don't have this understanding of cancer. Why do you think conversations like this are so important? And I'm really asking both of you in the public sphere for people to feel less afraid, for breast cancer and really all cancers to be less stigmatized.
Mhm.
Why do you think this is so valuable for someone who doesn't have LaShaye's background, your
Mhm.
background, or even my background?
Mhm.
Mhm.
It's such a good point. I mean, I think that at a minimum, it gives folks a language to even talk about, right? Because all of these terms that we're using, if you're not dealing with cancer care or you don't know someone who's been affected by cancer, it's alien concepts talking about tumor size and grade and receptors. So I think that the more and more that the community can understand and have an awareness of what's going on with respect to cancer, it's just a good thing. It's not that we want to normalize, but in some ways you sort of do because it's part of life and it's really understanding that if you have a problem, go to a physician, get yourself checked out. I think giving information to the community is just always valuable. It's never a bad thing.
LaShaye, I know that, as I said, you have been able to translate your academic understanding of cancer as well as your personal understanding
Mhm.
of cancer to all kinds of people. And why do you think that's so valuable in terms of sharing your journey with complete strangers, by the way?
Yeah. I think it's very important because you need somebody out there to look up to and who's going through a similar thing. We all need that support person. We all need that person who's saying, "Oh, well, she went through the same thing and she can do it. Maybe I can do it." And I think you also need people who understand what's going on to break it down in a language
I
you
was
could
I
understand.
was gonna say, I think you need someone to translate all this
Yeah.
science, and no offense, Lillian,
Oh,
you're
No
really
offense
good at
taken.
it. You're really good at explaining, but a lot of doctors and scientists are so used to kind of
Mhm.
talking about
yeah.
something at this level, they're not very good at dumbing it down
Yeah.
Yeah.
because they're so smart, basically.
Yeah. I think
And
that's the
and I think,
benefit.
for you to do that, LaShae,
Mhm.
is so helpful for people.
Yes, I think it's a big benefit to public health and public health training. What they teach us is you have to find ways to break down for any disease messages at a fifth grade level so that everybody, no matter what, they can understand. And so that's something I already had with my training was that you have to be able to give messages in small bursts because people might not want to pay attention for as long and just let them know the key things. And so with early breast cancer detection, the biggest thing that I try to send a message about is if you get screened early, so when you look at the American Cancer Society and you look at some of the things they have, if you get screened and you find it early, you have a high likelihood, a high chance of being around. So, you shouldn't be that scared and see nice people like Dr. Smith. She'll get you in a good position.
And, I think I applaud you for so many things, LaShae, that you are doing. I think you're taking a personal challenge, and I'm sure what was a very frightening experience, and you're using it to really help other people, which I think is very therapeutic. It was certainly therapeutic for
Mhm.
me when I lost my husband to colon cancer, and really therapeutic when I experienced breast cancer
Mhm.
myself, to be able to share what I learned to other people.
Mhm.
But I also so appreciate the fact that you're participating in some studies that
Mhm.
will really help doctors like Lillian
Mhm.
understand some of the biology of this disease. Tell us about that.
Yeah, so I thought it was extremely important because one of the things we tend to look at is genetic mutations. And for me, when I did the test, the comprehensive test, there were no genetic mutations that I had linked to any cancers, not just breast cancers.
Well, at least
None.
known genetic
No.
mutations,
That's
Correct.
what I was
right?
about to
Right.
get to. And so what I did was I donated my tissue because right now at they're doing studies where they're
University
looking
of
at
Miami.
oh yes, at University of Miami, they're doing studies where they're looking at West African genetic people of West African genetic ancestry, which I happen to be a part of, and they're looking at our tumor biology to see if there's another gene that we're unaware of and other genetic factors. And so that's one of the things. Maybe down the line, there might be a reason that I got this because right now we don't know none of the known risk factors. I have none of those. So, no family history. I exercise, ate right, all those nice things, never smoked, don't drink, nothing. And so, I wanted to pay it forward because me as a researcher, I want to get data. I want people to participate. And so I wanted to be a part of pushing the science forward. And I think it's so important because it helps not only you, but others. And if you participate in clinical trials, you get more appointments. You get to see your doctor, you get extended care. Who doesn't want that?
It is really important that the data represents a broad swath
Oh,
of
absolutely.
Mhm.
of human biology,
Mhm.
isn't it?
It's incredibly important, and LaShae and I were chatting about this before the recording. It is just unbelievably amazing to advocate for improving research in breast cancer, clinical trial participation.
Mhm.
I mean, we are going to learn so much more if we all work together,
Mhm.
contribute tissue samples, participate in clinical trials. It's how we learn, it's how we advance the field, and I just commend you for doing that because someone will benefit from that. It really that's how it works.
Yes.
What is the most important thing for both of you to leave patients or just people who are perfectly healthy?
Mhm.
Mhm.
What do you want them to know after watching this? What are sort of the top line messages you would like to impart?
One of the biggest things I'd like to impart is that if for some reason you do get cancer, it's not a death sentence and you can be like me. You can go through treatment and you can be cancer free. You can look quote unquote normal, like nothing ever happened to you. Lift 408 pounds before your last chemotherapy treatment. And yeah, you can just live an amazing life. And also, just be aware of your body. Get to know your body. If it's one thing you learn from this session and watching us here, get to know what is your normal. And if you see something wrong, get it checked.
And what about you, Lillian, especially for people once their treatment is
Mhm.
complete? What do you want those people watching to understand?
Yes, I have a very similar message to LaShae. There is life after breast cancer. Most patients who are diagnosed with early breast cancer, once they've completed treatment, this becomes something in their rearview mirror. It is very unlikely to be an issue for them again. And I think that's a piece of information that isn't out there.
Mhm.
And I would like to emphasize that. I would also say, we've touched on this for the patients who are hormone receptor positive, who've been recommended hormone therapy, do try to stick with it. I know it's hard. We know that adherence can be hard. We know that patients often struggle to even admit to their provider that they're struggling with the side effects. But I would say if you are struggling, speak up, speak to your doctor, because there are ways that we can help. There are other options that we consider.
Mhm.
So I think that's an important message. And then I would say, it's like all of us. Try to do as best you can. Exercise, eat well, reduce alcohol, avoid smoking, and just get back to living your life.
Well, this has been such an important conversation. LaShae, I'm so grateful for you talking about this and sharing your story. And Dr. Smith, Lillian, I'm so grateful for your dedication to all your patients and to breast cancer research. I applaud you and all your fellow clinicians and scientists. You are my heroes,
Mhm.
and I've added you to my list too.
Oh, thank you so much. You're already on my list, so
Thanks so much to both of you. Really appreciate
Thanks
it.
for having me.
thank you so much. Thank you all.